The revised self-report assessment of functional visual performance is a 33-item questionnaire designed to assess limitations in activities of daily living in adults with low vision that also includes questions pertaining to instrumental activities of daily living, such as computer and telephone use. It is typically administered to older adults with low vision impairments to determine the extent of interference with occupational performance. It is a standardized test. Adequate evidence of validity and reliability in evaluation of older adults with low vision was demonstrated in the American Journal of Occupational Therapy with Cronbach's alpha range 0.72 to 0.84 for individual components and an overall value of 0.92. The tool can be accessed at www.uab.edu. 33 items on the revised self-report assessment of functional visual performance are divided into categories: health management, personal grooming, meal preparation and clothing care, financial management, using the telephone, reading, writing, functional mobility, and personal preference activities. Each item is self-rated by the client on a scale from 0 to 4 or rated non-applicable, with 0 indicating the client is unable to perform the activity independently and 4 indicating the client is able to perform the activity independently. Let's take a look at administration of an assessment with our client Vivian, a 28-year-old female with diabetic retinopathy. If the client is able to complete the assessment independently, ask them to do so. If the client is unable to complete the test themselves, you can ask the client to answer the question verbally, and then you would complete the answers on the phone. Here we can see the completed assessment. Note that the client scored a total of 84 points across the 33 items, scoring complete points in health management, financial management, personal grooming, using the telephone, and writing sections, 3 of 4 points in functional mobility and personal preference activities sections, and no points in reading, meal preparation, and clothing care sections. Calculations for cumulative scores total 84 points, divided by 132 possible points equals 64% functioning, or 36% impairment. These results translate to Center for Medicare Services G code CJ, indicating at least 20% but less than 40% impairment, with notable deficits in reading and meal preparation and clothing care sections. When we plug these values into the pre-programmed Excel spreadsheet, we can see that areas with values of 2 points or less are highlighted in red. These are the occupational categories most affected by low vision impairment. Interventions should prioritize treatment in these areas. Because the client scored lowest on reading and meal preparation and clothing care sections, treatment should prioritize occupations within these categories. An action plan for these deficits would most likely include collaboration with the client, caregivers, and other health professionals to develop goals corresponding interventions that include compensatory strategies for reading and meal preparation and clothing care. Examples of these interventions would include use of magnifying glasses or Be My Eyes application for reading, as well as bump dots or puff paints or contrast tape for use in the kitchen to assist with meal prepping. It will also be important to reevaluate occupational performance in these areas after implementation of the intervention.